This lecture is about the movements of eyeball produced by the extraocular muscles of the eyeball. These are the extraocular muscles of eyeball. Now, these are the muscles. First, we see the axis around which these muscles cause the movement of eyeball. This is the superior side, inferior, this is anterior, this is posterior side. Now the side which is out of the plane of paper is medial side, and the lateral side is pointing upward to the plane of the paper. Now this is the superior oblique muscle, this is levator palpebrae superioris muscle, this is superior rectus muscle, this is inferior oblique muscle, this is medial rectus muscle, and this is the cut section of muscle. This is lateral rectus muscle. This is the strap of lateral rectus muscle. This is eyeball, which is representing in the green area. Now we see the movement of eyeball produced by individual extraocular muscles. Again we see the axis. This is anterior, this is posterior, this is lateral, and this is medial. This is the anterior and this is posterior. Now first we see the muscles which cause the elevation of eyeball. The inferior oblique and superior rectus muscle around the transverse axis. This is transverse axis. Inferior oblique and superior rectus muscle cause the elevation of eyeball or upward rotation or elevation at 33 degree, and these are the muscles which cause the depression of eyeball, inferior rectus and superior oblique muscle. These muscles cause downward rotation, these cause upward rotation, these cause downward rotation. These muscles, inferior rectus and superior oblique, cause downward rotation or depression at 33 degree around the transverse axis. Now we see the adduction and abduction of eyeball. First we see the adduction. Adduction is the movement of eyeball toward the medial side, and this is caused by medial rectus muscle, and the accessory muscles are inferior rectus and superior rectus. The axes are, this is anterior, this is posterior, lateral and medial. Abductors, these causes the eyeball to move laterally. These adductors cause the movement of eyeball. Abduction is the movement of eyeball toward the medial side, and this is caused by medial rectus muscle. Accessory muscles are inferior rectus and superior rectus, and this movement is around the vertical axis. This is the vertical axis. Now the abductors, inferior oblique cause inferior oblique and superior oblique are accessory muscles, and lateral rectus is the major muscle which causes the abduction of the eyeball and causes the eyeball to move toward the lateral side. The rotatory movements of the eyeball upward, downward, medially or laterally are defined in terms of direction of movements of the center of the pupil. The torsions, extorsions or intorsions are defined in terms of the direction of movement of the upper margin of the pupil at 12 o'clock position. At 12 o'clock position. Now we see the intorsion. Intorters, superior oblique and superior rectus are the intorters, and they cause the movement of eyeball in clockwise direction, in clockwise rotation around the anterior-posterior axis. This is the anterior-posterior axis. This is anterior, this is posterior, this is lateral, and this is medial side. And these intorters, superior oblique and superior rectus, causes the anterior-posterior axis movement. These are intorters and cause the clockwise direction, in clockwise direction. This is the clockwise direction. And these are the extraorters. They cause the movement of eyeball, rotation of eyeball around the anterior posterior axis in anticlockwise direction. And this is the anticlockwise direction, and these muscles are inferior oblique and inferior rectus. Now we see the individual muscles which cause the movement of eyeball. The superior recti causes the movement of eyeball in medial direction, in medial position. They cause movement of eyeball in upward. First we see this is the normal position of the eyeball, and the pupil present in the center. Now the first case, superior recti in medial direction. This is the medial. They cause in medial position, they cause the movement of eyeball upward. And inferior oblique muscle causes the movement of eyeball upward in lateral direction. This is lateral side. And superior rectus causes the movement of eyeball to upward in medial direction. And this is inferior recti. Inferior recti causes the movement of eyeball to move inferiorly in the medial direction, and also this is the movement of eyeball downward in the medial direction. This is the superior oblique muscle. Superior oblique muscle causes the movement of eyeball downward in the lateral position, while inferior rectus causes the eyeball to move downward in medial position. Superior rectus and inferior oblique muscle causes the eyeball to move upward in the center. Also superior rectus and inferior rectus causes the eyeball to move upward in the center. This is the same case. And this is the lateral rectus muscle. This is lateral rectus muscle causes the eyeball to move laterally, horizontal direction. Medial rectus causes the eyeball to move medially. This is medial side, this is lateral side. Now the inferior rectus and superior oblique muscle causes the eyeball to move downward in the center. Inferior rectus and superior rectus causes the eyeball to move downward in the center. Medial rectus causes the eyeball to move medially, horizontally. This is medial side, this is lateral. Lateral rectus muscle causes the eyeball to move laterally in horizontal direction. This is lateral side. These were the muscles which causes the eyeball to move in different direction: medial, lateral, superior, inferior, clockwise, anti-clockwise, and rotation. And these are important clinically. If the damage to any nerve supplying the extraocular muscle causes the defective movement or abnormal movement